Hello, today I'm going to be talking about ShigellaFlexneri. What is shigellosis? Overall, shigellosis is a bacterial infection in the intestinal tract in both humans and primates, specifically gorillas. It resembles E. coli and was discovered by Kiyoshi Shiga, who was a physician in 1897, and it is the leading cause of diarrhea worldwide. Shigella flexneri is a byproduct of Shigella, where there is a total of 4 variations. Flexneri is a gram-negative bacteria that can also be self-limiting but also deadly. It causes 164 million deaths each year and is the leading cause of death within children. It invades the colon and immune tract and can also replicate very quickly. So, how do you know if you got Shigella? The symptoms are prolonged watery or bloody diarrhea, fever, stomach pain, vomiting, dehydration, and convulsions. But it also has worst case scenarios such as arthritis, which occurs in only 24% of people with specific genetics, bloodstream infections, which less than 10% develop this, and it happens when Shigella enters the bloodstream, seizures, which can only happen in young children and go away without treatment, and hemolytic uremic syndrome, which is toxins that develop and kill red blood cells, but it's pretty rare. Shigella flexneri is a highly infectious and only needs 100 cells to start the infection. It is mostly found within feces of infected people and can affect all age groups. However, young children, elderly, and immunocompromised people are most at risk. You can not only get Shigella from sexual activity, but by also not washing your hands, swallowing recreational water. Once you get Shigella, it heads immediately to the colon to then infect the mucosa. And that is shown here on this diagram where it shows it's invading first the mucus layer of the skin of the colon. So how long does it last? It can last up to 7 days and sit dormant for 1 to 2 days with a 40-minute doubling time. Sometimes it does take several months for bowel habits to return back to normal. Doctors will prescribe antibiotics but recommend getting a vaccine if it's specifically Shigella flexneri, as it helps better more than the antibiotics with less risk. You'll want to also drink plenty of fluids because dehydration is a really big problem when it comes to Shigella. And if you're having diarrhea, do not take any medications that will help with diarrhea specifically. And once you are prescribed antibiotics, you want to finish all of the pills. Okay, as I've said in previous slides, and still wash your hands. And that's before eating, before sexual activity, after using the bathroom, and touching dirty surfaces. Assume all surfaces are dirty, no matter what. 2. Avoid swallowing recreational water from ponds, lakes, and swimming pools. 3. Make sure to ask and talk to your partner before doing anything anal related during sex. If they're sick, wait 2 weeks after diarrhea stops. And if you're sick, please stay home and that includes your children as well. As it says, we truly are freaky. Shigella is actually most common in the United States, but specifically Shigella sonnei and flexneri. Overall, Shigella causes 450,000 infections in the United States each year, mostly in the summer and early fall. From 2009 to 2018, children 13 to 17 were most affected. It was highest among black males, 16 to 2%, 16.2%, sorry, Hispanic 13.1%, and Native American children at 15.2%. Overall, everyone should be cautious about any STI, but make sure you're always practicing safe sex. Here are my works cited, and thank you.